Avian flu, a disease that affects birds, has reached New York City. In February 2025, several birds at the Bronx Zoo and the Queens Zoo died from suspected avian flu. Tests confirmed that 3 ducks at the Queens Zoo died from the virus. More tests are being done on other birds that died, including 3 ducks and 9 wild birds at the Bronx Zoo. This outbreak is part of a larger problem. Across the United States, avian flu has been found on farms, leading to the deaths of millions of birds. This has caused a rise in the price of eggs. The situation in New York City shows that the virus can also affect wild birds and birds in zoos. The avian flu virus spreads easily among birds. It can be spread through the air, through contact with infected birds, or through contact with contaminated surfaces. Birds can also carry the virus without showing any signs of illness, making it difficult to control the spread. The outbreak in New York City has raised concerns about the health of birds and the potential for the virus to spread to humans. Authorities are taking steps to contain the virus and protect both birds and people. Zoos are taking the avian flu outbreak very seriously. Birds in zoos are often kept in close quarters, which can make it easier for the virus to spread. Zoos are home to many different species of birds, some of which are rare or endangered. To protect their birds, zoos have taken several precautions. Some zoos have closed their bird exhibits to the public, while others have increased cleaning and disinfection protocols. Zoos are also monitoring their birds closely for any signs of illness. In New York City, the Bronx Zoo and the Queens Zoo have moved their most vulnerable birds to protected areas. These areas are indoors and have limited access to prevent the spread of the virus. Zookeepers are taking extra precautions, such as wearing protective clothing to avoid spreading the virus. The avian flu outbreak is a serious threat to zoos, but zoo staff are working hard to protect their birds. By taking these steps, zoos can help to slow the spread of the virus and protect their birds from becoming infected. In addition to zoos, New York City is also home to a large population of wild birds. These birds can be found in parks, gardens, and even on city streets. Wild birds can also be affected by avian flu, and they can spread the virus to other birds, including domestic poultry. To reduce the risk of avian flu spreading among wild birds, New York City has closed all live bird markets. These markets are a common place for people to buy and sell birds, and they can be a breeding ground for the virus. The closure of these markets is a precautionary measure to prevent the virus from spreading further. The city is also asking residents to report any sick or dead birds they see. This information can help authorities track the spread of the virus and take steps to contain it. It's important to remember that wild birds are part of the city's ecosystem. While it's necessary to take precautions to prevent the spread of avian flu, it's also important to protect wild birds and their habitats. Section 4. Avian flu's impact on farms and food. The avian flu outbreak is not just a problem for zoos and wild birds, it's also having a significant impact on farms across the United States. Millions of chickens and turkeys have been culled or killed to prevent the spread of the virus. This has led to a decrease in the supply of poultry and eggs, which has caused prices to rise. The culling of so many birds is a necessary step to control the outbreak. However, it is also a difficult and costly measure. Farmers are facing significant financial losses, and consumers are feeling the pinch at the grocery store. The avian flu outbreak highlights the interconnectedness of our food system. When one part of the system is affected, it can have ripple effects throughout the entire system. The outbreak also underscores the importance of biosecurity measures on farms to prevent the spread of diseases. Section 5. The risk to humans. While avian flu is primarily a threat to birds, it can also infect humans. However, the risk of human infection is low. According to the Centers for Disease Control and Prevention, there have been 67 confirmed cases of human infection with avian flu in the United States. However, there have been no reported cases of human-to-human transmission. The people who are most at risk of contracting avian flu are those who have close contact with birds, such as poultry workers and veterinarians. Symptoms of avian flu in humans can range from mild, like conjunctivitis, to severe, like pneumonia. In severe cases, avian flu can be fatal. Although the risk to the general public is low, it is important to be aware of the symptoms of avian flu and to take steps to prevent infection. These steps include washing your hands thoroughly after handling poultry or eggs, cooking poultry to an internal temperature of 165 degrees Fahrenheit and avoiding contact with sick or dead birds. Section 6. Stopping the spread. Stopping the spread of avian flu requires a multifaceted approach. One important aspect is surveillance. Public health officials are constantly monitoring the situation, tracking cases in birds and humans, and testing for the virus in different environments. This information helps them understand the spread of the virus and implement appropriate control measures. Another crucial element is biosecurity. On farms, this involves measures to prevent contact between domestic birds and wild birds, strict hygiene protocols for workers, and regular cleaning and disinfection of poultry houses. For the general public, biosecurity means avoiding contact with wild birds, especially sick or dead ones, and reporting any unusual bird deaths to the authorities. Vaccines are another tool that can be used to control avian flu in birds. While there is no vaccine available for humans yet, research is ongoing. Vaccines can help reduce the severity of the disease in birds and slow down its spread, protecting both animal and human health. Where's Section 7? Staying informed. The avian flu outbreak is a dynamic situation and information is constantly evolving. It is crucial to stay informed about the latest developments and recommendations from reliable sources, such as the CDC, the World Health Organization, and local health authorities. These organizations provide up-to-date information on the outbreak, including the number of cases, the geographic spread, and any recommended precautions. Pay attention to news reports, but be wary of misinformation and sensationalized stories. Look for information from credible sources and remember that the best way to protect yourself and your community is to follow the advice of public health experts. By staying informed and taking appropriate precautions, we can all play a role in controlling the spread of avian flu.